Hello friends, today we are going to discuss here about organophosphate poisoning, and in last of this video I'm going to discuss theory of this mnemonics. So let's begin. This is important topic. One MCQ in your exam from this topic. Mechanism of action of organophosphates is inhibition of acetylcholinesterase, inhibition of monoamine oxidase, activation of acetylcholinesterase, or D is blockage of muscarinic receptor. So the single best answer here is inhibition of acetylcholinesterase. Okay, organophosphates irreversibly inhibit acetylcholinesterase, causing accumulation of acetylcholine at synapses. Now, which of the following is not muscarinic manifestation of organophosphate poisoning? Meiosis, bronchoria, bradycardia, and muscle fasciculation. So muscarinic in organophosphate you see dumbbells. So rule out except dumbbells DUMBELSS. Okay, so D for diarrhea, U for excess urination, M for meiosis. So meiosis is a muscarinic. B for bronchoria, double B, dumbbells, and B for bradycardia, and L for lacrimation, S for salivation, X for sweating. But muscle fasciculation sees as a nicotinic manifestation of organophosphate poisoning. So answer here is muscle fasciculations. Now, so muscle fasciculations are nicotinic effects. The acronym dumbbells is used for which group of symptom? We already discussed about muscarinic. Okay, muscarinic, like diarrhea, urination, meiosis, bradycardia, bronchospasm, emesis. E for emesis means vomit, lacrimation, salivation, or you can say sweating. The antidote for organophosphate poisoning is atropine and pralidoxime, physostigmine and diazepam, adrenaline and dopamine, neostigmine and atropine. So answer is atropine and pralidoxime. Atropine, competitive antagonist of acetylcholine at muscarinic site, and pralidoxime is 2-PAM, reactivates acetylcholinesterase if given before aging. Aging in organophosphate poisoning refers to structural modification of the enzyme inhibitor complex, accumulation of acetylcholine, loss of antidote response, or metabolism of the toxin. So the best answer here is structural modification of enzyme inhibitor complex. Once aging occurs, pralidoxime cannot reactivate the enzyme. Which drug should be avoided in organophosphate poisoning, OP poisoning? Like diazepam, morphine, atropine, pralidoxime. Atropine, pralidoxime we use in opioid poisoning, and diazepam also used for seizures treatment in OP poisoning, but morphine is answer. It should be avoided because morphine causes respiratory depression, and respiratory failure is a common cause of death in OP poisoning. So morphine depresses respiration and may worsen respiratory failure. Pralidoxime is most effective when given immediately after exposure, 24 hours after exposure, after atropine administration only, after enzyme aging. So best answer here is immediately after exposure. It must be given early, within hours before aging of the enzyme occurs. Intermediate syndrome in OP poisoning occurs after 2 to 4 hours, 24 to 96 hours, 7 to 10 days, or 2 weeks. Best answer here is 24 to 96 hours. Characterized by respiratory muscle weakness and cranial nerve palsies due to persistent ACH exists at NMJ. Which of the following best monitors severity and recovery? Serum acetylcholine level, RBC cholinesterase level, plasma acetylcholine level, or urinary metabolites? So best answer here is RBC cholinesterase level. RBC cholinesterase reflects true neural enzyme activity. In a suspected OP poisoning patient with respiratory distress, the first step in management is pralidoxime injection, airway breathing circulation support, atropine infusion, gastric lavage. Always maintain airway breathing and circulation. This is the first step. Always stabilize airway and breathing before specific antidotes. Okay. Which of the following is a delayed complication of OP poisoning? That is seizures, intermediate syndrome, organophosphate induced delayed neuropathy, or bronchoria. So the best answer here is neuropathy is not developed immediately. Okay, so this is the delayed complication. OPIDN appears after 1-3 weeks due to distal axonopathy, mostly triacylglycerol phosphate type. Atropine endpoint in OP poisoning is tachycardia more than 120 per minute, dry mouth and skin, pupillary dilation, resolution of fasciculation. So what is the endpoint in OP poisoning? Endpoint is dry mouth and skin. Okay. Atropinization, dry lungs, dry mouth, adequate heart rate, mydriasis may occur. Oximes like pralidoxime are ineffective against which poison? Parathion, malathion, carbamate, chlorpyrifos. So guys, this answer here is carbamate. Carbamate reversibly inhibited acetylcholinesterase, oximes not needed. Cause of death in acute OP poisoning is usually, I already explained in this video only. So that is respiratory failure. So options are cardiac arrest, respiratory failure due to bronchoria and paralysis, seizures and hepatic failure. So answer here is respiratory failure. Let's discuss some theory here. So organophosphate poisoning high yield summary. OP compound inhibit acetylcholinesterase, ACE, increase ACTH, not ACTH, sorry. Causes cholinergic crisis involving muscarinic, nicotinic and CNS receptors. Muscarinic like dumbbells, D4 diarrhea, urination, meiosis, bronchospasm, bradycardia, emesis, lacrimation, salivation and sweating. Nicotinic is muscle fasciculation, weakness, paralysis, tachycardia and hypertension. CNS is confusion, seizure and coma. Diagnosis, clinical, most important, history plus typical cholinergic signs. Labs, you find decreased RBC cholinesterase. True ACE, most specific, decreased plasma pseudocholinesterase, supportive garlic order pinpoint pupils. Treatment is by atropine, first line, dose 1-2 mg IV, repeat every 5 minutes until dry lungs, no bronchial secretion or heart rate more than 80. May require very high dose, 10 to 50 mg. Pralidoxime antidote reactivate ACE before aging occurs, dose 30 mg per kilogram IV over 30 minutes, then infusion. Best is given within 24 hours. Decontamination. Remove cloth, wash skin, activate charcoal if ingestion within 1 hour. Supportive oxygen intubation if respiratory failure, treat seizures with benzodiazepines. Complications like respiratory failure, main cause of death, intermediate syndrome 24 to 96 hour, delayed neuropathy weeks and later. Prevention of aging permanent binding of OP to ACE, pralidoxime ineffective, occurs fast with serene minutes and parathion with hours. MCQ very high yield, remember some points. First drug in OP poisoning is atropine. Antidote for OP poisoning is pralidoxime. Most specific test is RBC cholinesterase. Cause of death is respiratory paralysis. Features due to nicotinic receptors, fasciculation, weakness and tachycardia. Muscarinic effect is recommended by dumbbells. So guys, if you are preparing for NEET PG, you can take subscription program for 2026 exam. Okay, and how to join that subscription program, details available in description of this video. Thank you. If you like this video, put like on it. If somebody is new on my channel, please subscribe this channel for more such videos. And if you want, you can share this video. Thank you.